My name is Ahmedzai. I used to be Professor of Palliative Medicine at the University of Sheffield, but now I work for the NIHR. My national role is I'm a national specialty lead for research in the cancer area, but focusing specifically on supportive care and research in the community. When I started this work 3 years ago, we realized quite early on that a very important part of the professional workforce delivering research in cancer and also in other conditions in supportive care in the community actually come from the hospice world, the hospice and also the related community workforce as well. And we realized we were not engaging so well with that professional community. So 2 years ago, we set up a summit meeting between the NIHR office and a collection of leading national charities and also some academic departments. And from that first meeting 2 years ago, we now have something called the NIHR Hospice and Community Research Consortium. The main purpose of the NIHR Hospice and Community Consortium is to bring together these two large communities. On the one hand, we have the National Institute of Health Research with its vast resources for helping researchers get research started, delivering research, making sure that research is performed to target and on time. And on the other hand, we have the researchers who are themselves delivering that research. And they are scattered in hospices, in community teams, also collaborating with teams in hospitals as well, that interface between the acute hospital and the community. So what the consortium is doing is allowing these two large communities to work together. When we sat down together, firstly as a summit meeting, but now as a functioning consortium, we set ourselves some perhaps quite ambitious objectives. We said, within 5 years, we want to be one of the leading countries in the world in hospice and supportive care research. So how are we going to do this? The metrics we're going to use are that every year we're going to increase our research output in this field by 5%. So that's one step. The next target is that by the year 2022, we want to have every single research network in the country, every single one of the clinical research networks, putting patients into studies in hospice and community-based research. At the moment, it's quite patchy, and we're going to deliver that by going out there and engaging with the clinical research networks and the hospices and research communities who work in those patches. And then the final output is that, again, by the year 2022, we want there to be every year one major practice-changing piece of research which is published from this exciting community to say that actually now the UK is an international leader in hospice and community research. So to recap, the consortium consists of the NIHR with all its resources behind it and this quite diffuse community of researchers in hospices, in community teams. Bringing those together, we realized that we need to both deliver from both sides to support each other to deliver those objectives. So from the NIHR perspective, we're undertaking to provide information, training, education for would-be researchers and also those researchers who've just put their first step into the ring to help them to get established. The ways we can do that are by putting them in touch with their local clinical research networks. If they're in a remote hospice, maybe in touch with an academic centre where there's resources there to help them design research studies and then get those studies done. So the NIHR is helping the researchers to come into this large cancer research community. From the charity side, what we want is the charities to recognise the importance of research. Now, some of the charities are already delivering that by giving out research grants, but not all do. We're not necessarily wanting the charities to give money, but really what we want is that, first of all, they should recognise research as being an important part of what they deliver for their particular population, whether it's adults or children or teenagers. Secondly, we want the charities to be able to support their own staff in conducting research. So for instance, it might be releasing a doctor or a nurse or an allied health professional for a day a week in order to do research. Thirdly, what we want the charities to do is to meet together every year with us in a consortium conference to update each other and also to update the UK on the progress that we're making. So this year in April, we held our first consortium conference, and this was held at the BMA House in London, a large audience from all sorts of disciplines. We had Baroness Julia Neuberger opening the meeting with Matt Seymour, who's the clinical director of the NIHR cancer cluster. And what we did there is that we launched the idea of the consortium and those objectives, but very particularly we highlighted some major pieces of research which are already taking place. We gave out prizes to research teams and to individual hospices who've made great strides in going from research inactive to very much in the front line of being active research hospices.